hospitals, while our entire state and most of the nation are struggling to care for a surge in COVID-19 illness. A month ago, I told you that COVID-19 cases were increasing after several months of relatively stable numbers. The statistics show that August was much worse than July, and unfortunately that trend is continuing into September. There were 451 new COVID-19 cases among Yellowstone County residents in July, and 1,993 cases in August. In fact, we had more new cases in August in Yellowstone County than in April, May, June, and July combined. The nearly 2,000 new cases in August was the highest since December 2020, when 2,810 Yellowstone County residents tested positive for COVID-19. This morning, Riverstone Health's case investigators added 238 new COVID-19 cases, giving us 1,020 cases awaiting investigation. Because the number of people testing positive has been more than we have staffing capacity to thoroughly investigate each and every case, we mailed letters to each of those people advising them of the Centers for Disease Control and Prevention recommendation for isolating themselves to avoid spreading the virus to others. That letter also asked them to notify their close contacts, because Riverstone Health does not have the ability to notify all those close contacts. We are prioritizing investigation of COVID-19 cases in people under the age of 19, school-aged children, and those too young for school. Today, we have 59 new cases in this group awaiting investigation. Among those cases, the average age is just 12 years old. In the week ending September 4th, in Yellowstone County, we had 180 new cases in people under the age of 19, representing 24% of all COVID-19 cases in the county for that week. This rate of about 1/4 of all new cases affecting children and youth is consistent with findings nationally and represents a substantial increase from earlier in the pandemic. In the first week of August, we had 29 cases in minors, representing just 18% of all new cases. Those 180 cases reported last week included 91 high school age students, 26 middle schoolers, 32 elementary students, and 31 children under the age of 5. It's been a while since I've shared information about case investigation and contact tracing, and I think it's helpful to give some perspective in terms of numbers and time. Today, we have 1,555 people in our community who have tested positive for COVID-19 and are considered active cases. The estimated average time it takes to investigate and trace one case is an hour. That is 1,555 hours. Conservatively, if each of those people had just 4 close contacts, there are 6,220 additional people who need to be advised of quarantine and symptom monitoring recommendations. Just like the hospitals and every other organization in our community, our resources are not unlimited. I want to talk about hospital patients now. With the increased number of new cases in Montana, Billings hospitals are treating dozens of COVID-19 patients daily. During August, St. Vincent Healthcare and Billings Clinic together admitted 140 new COVID-19 patients. This was the highest monthly total since December, near the peak of our first COVID surge, when those hospitals admitted 156 new patients. As of today, our 2 hospitals have 99 COVID-19 inpatients, including 36 in the ICU and 23 on ventilators. Yesterday, Wednesday, September 8th, marked the first time since December 18th of 2020 that our 2 hospitals had 100 or more COVID-19 inpatients. Please note how serious the current situation is. We have our highest number of hospitalized COVID-19 patients in 9 months. In December, we were just beginning to administer COVID-19 vaccines, so those hospitalized did not have the layer of protection that vaccination provides. To provide our community with a clearer picture of the situation, Riverstone Health St. Vincent Healthcare, and Billings Clinic have begun to post a hospitalization infographic on our Facebook accounts. We plan to update the numbers every weekday. We also get a lot of questions about whether the vaccines really do help to reduce the likelihood of severe disease and hospitalization. The data are very clear. There are some breakthrough cases in which fully vaccinated people get ill enough to be hospitalized, usually involving people with very significant underlying medical disease. But the vast majority of hospitalized patients are unvaccinated. Today, for instance, 91 of the 99 patients hospitalized for COVID-19 in our community are unvaccinated. That's 91% of those hospitalized patients are unvaccinated. While no vaccine is 100% effective, the 3 COVID-19 vaccines approved for use in the United States are safe and highly effective. This has been demonstrated in clinical trials with thousands of Americans and in the millions of vaccine doses administered this year. In Yellowstone County, 68,093 of us have been fully vaccinated against COVID-19. That is half of all Yellowstone County residents aged 12 and older, those who are eligible for the vaccination right now. However, this is only about 42% of the total population of Yellowstone County. The Pfizer vaccine has FDA and CDC approval for use in people aged 12 and up. We still don't have approval for vaccinating younger children. Research on the proper dose and use of COVID-19 vaccines in children is still ongoing. Because our youngest residents cannot be vaccinated, we need to pay special attention to prevent them from exposure to the COVID-19 virus. Frequent, thorough hand washing, physical distancing, and masking those over age 2 is recommended to reduce the risk of a person getting infected. People who take personal responsibility and action to avoid infection cannot spread the virus to others. And I want to take some time now to address an issue that has generated a number of questions over the last few weeks, and that is House Bill 702. This new Montana state law poses an ethical dilemma for public health and healthcare professionals. The state law forbids treating unvaccinated and vaccinated people differently. So when people are exposed to a person infected with COVID-19, this law dictates that either all exposed people must be quarantined or none of the exposed people can be required to quarantine. This conflicts with CDC guidance. The CDC recommends that unvaccinated people quarantine, but fully vaccinated people who are close contacts do not need to quarantine or miss work or miss school. Those who are fully vaccinated don't need to quarantine because their risk of infection is much lower, according to the CDC. These CDC recommendations are based on objective research conducted over the past 18 months. House Bill 702 places public health and healthcare professionals in our state in an impossible situation: follow the law and violate best practices defined by science, or follow the science and violate the law. I am sure that this is an unintended consequence of this new law, and I hope that the legislature will act to rectify it. Vaccination is the only way out of this downward spiral of infection, illness, hospitalization, and death. This week, Yellowstone County hit a somber milestone. COVID-19 has appeared on the death certificates of 302 of our friends, family, and community members. Those 302 COVID-19 related deaths in 18 months are 13 times the number of Yellowstone County residents who died of influenza in a 5-year period beginning with the 2015-2016 influenza season. Please note this 5-year period does not include the 2020-2021 influenza year, in which no confirmed cases of influenza were recorded in our state. In August alone, Yellowstone County lost 15 residents to COVID-19 illness, 1 every other day. This is the highest number of deaths in a month since 25 Yellowstone County people died in January. Those 15 people who died in August ranged in age from their 30s to their 80s. In the first few days of September, Yellowstone County has recorded 2 more COVID-19 related deaths, including a woman in her 20s. This young woman is the youngest COVID-19 related death in our state. Many people who survive COVID-19 illness continue to have health-related problems weeks or even months later. Loss of the senses of taste and smell, extreme fatigue, and respiratory problems can linger, even in people who are young and healthy before being infected with COVID-19. Because COVID-19 is still new, we don't know what the long-term health effects will be once a person is infected. The best protection from this infection is vaccination. Vaccines are available at retail pharmacies, medical clinics, and hospitals. The current spread of COVID-19 in Montana involves a newer variant of the original virus, which is named for the fourth letter of the Greek alphabet, Delta. The Delta variant appears to be much more easily transmitted from person to person. Even some fully vaccinated people have been infected. However, those who are vaccinated are much less likely to get sick or be hospitalized or die from COVID-19. Riverstone Health offers free COVID-19 vaccinations by appointment. Please go to covid.riverstonehealth.org for current information on making a vaccination appointment and for information on upcoming walk-in vaccination clinics. Also related to vaccines, we've been getting a lot of inquiries lately about COVID-19 booster shots. Currently, the only people CDC has recommended to have a third dose of Pfizer or Moderna are those who are immune compromised. This includes people age 12 and over who are being treated for cancer, who have an immune disorder, or who may be taking a medication that interferes with the normal function of their immune system. People should contact their healthcare provider to find out if they are eligible for a third vaccine dose due to being immune compromised. Riverstone Health is offering first and second doses of vaccine to everyone aged 12 and older at our walk-in clinics Saturday in North Park at the Pride Festival and on September 23rd in this building on our main campus. Immune compromised people may get their third vaccine dose at these free walk-in clinics as well. The CDC and FDA are evaluating the possibility of booster shots for other people aged 12 and over who have already had 2 doses of Moderna or Pfizer but are not immune compromised. We aren't providing booster shots for these individuals until the CDC recommends them. We expect more information in the coming weeks, but planning is underway for community vaccination clinics if and when booster shots become available to the general population. Again, thank you for joining us today. I wish I had better COVID-19 news to share. For now, what we need to do is this: encourage everyone aged 12 and over to get vaccinated. Take science-based steps to prevent the spread of the pandemic virus and prevent infection among those too young for vaccination and those who are at high risk for severe illness. Reducing COVID-19 infections will keep our students healthy and safe at school. Reducing COVID-19 spread will keep workers safe and at their jobs. And reducing COVID-19 transmission will support our businesses by assuring a healthy, vibrant consumer base. I'll now take your questions.
Yeah, this is Aaron Bolton with Montana Public Radio.
Hey, Aaron.
Just curious if Yellowstone County has seen any increases in vaccine uptake in recent weeks? We have.
Over the last about the last 4 weeks, as cases have increased, we have seen some increase in doses. We were down to administering about 1,000 doses a week, and in the last week we administered about 3,000 in Yellowstone County. So a 200% increase. I would note that is still about 1/3 of our peak. Back in April, we were administering 8,000 to 9,000 doses a week, but we have seen an increase. I'd also remind folks, for those who are concerned about not getting vaccinated until full approval was available, the Pfizer product does have full approval, is no longer under an emergency use authorization. So those who are waiting for that action, we'd encourage to come get vaccinated now.
Keith Schubert here with the Daily Montanan. You talked about HB 702 and how that plays with quarantining people who are unvaccinated versus vaccinated. I'm curious, are you requiring positive cases to isolate? regardless of vaccination status as recommended by the CDC? And if so, what does enforcement of those isolation mandates look like?
So we notify all cases that they should isolate. We do not in Yellowstone County issue isolation orders. So we don't issue a written order to them from the health officer saying they must isolate. So we depend on people to take the right actions to follow up with isolation recommendations. There's not sufficient resources to be able to enforce. Currently, there'd be more than 1,500 isolation orders. So we don't have a way to follow up on each one of those individuals.
Thank you.
Connor McCauley, NBC Montana. You talked about younger rates or youth rates going up. Do you attribute that at all to school being back in session? And if so, are you working with school districts to try to reduce those rates?
Yeah. So yes, it times out certainly with school being back in session. I think we need to remember there's a number of things that happen when school goes back in session that influence the rate of spread. So part of that is when school goes back in session, most people stop taking vacations. So the workplaces have more people in them. A lot of activities get it started. Boy Scouts, Girl Scouts, club sports, church activities, those sorts of things. And certainly being in school compresses more kids together. I met with the school superintendents every week during the previous school year. We met every 2 weeks over the summer, and we are now meeting every week again with the school superintendents via Zoom. And so what we do in those meetings is we provide the most updated data on school-age kids particularly, as well as it's a chance for those school districts to ask questions or share what they're doing. So it's a fairly robust community that's very active in terms of the schools working together and working with public health.
Aaron Bolton with Montana Public Radio again. Just to follow up on that, has any of your case investigations shown spread within schools, or does the increase seem to be more related to kids contracting COVID outside of school doors and bringing it into the classroom?
So, as I said, we have some limitations on the ability to investigate every case because of the volume of cases. We do have, for those we have spoken with, there's evidence of spread in both places, both within schools and within the community.
John, could you recap how School District 2 is doing contact tracing this year? Is it through Riverstone, or are they doing it, or is the administration doing it themselves?
No, we are doing the contact tracing for most of the schools this year, and the schools are not doing their own for the most part.
And do you have adequate staff to do all that for the schools?
We don't have adequate staff to follow all these cases as aggressively as we would like. We are in the process of we've hired several more case investigators. We're recruiting more, but it takes a little time, and the pace that cases are coming in right now, we just simply cannot keep up at this point. Any other questions?
I was going to ask real quick if you think a different approach may need to be taken in the future, just with a lot of similar messages being spread. I don't know if vaccine numbers are going in the right direction enough to feel comfortable with the messages being spread, but with this kind of being called the pandemic of the unvaccinated, do you see any more drastic measures taken as far as mandates or any other ways to get people to get vaccines?
Yeah, so in our state, those mandates are not legal. So certainly in Montana, you won't see vaccine mandates unless the legislature acts to modify that law. I think what we've tried to do is make vaccines widely available, easily available. There's lots of information about them. we're hopeful that some of those folks who were previously hesitant about getting vaccinated because of the emergency use authorization will realize that now that's been resolved for the Pfizer product. I'm hopeful that we will begin to realize that our community is at risk because of the spread of this virus. We have all of our businesses open, which we want, but if they don't have workers and they don't have customers, they can't survive. We have our schools open, which is what we want, but if we can't have staff and kids are sick, the schools can't operate. We all need to step up, do our job as individuals, and meet our civic responsibility to keep our communities vibrant and safe. And the fastest, surest, safest route to that is for more of us to get vaccinated.
Connor McCauley, NBC Montana again. I just wanted to ask, where are hospitals at in Billings in terms of capacity and resources?
They're extremely busy. This is a busy time of year for our hospitals. They're quite full. You've seen numerous reports of the hospitals being on divert from time to time because they have no capacity. For specific numbers in terms of capacity, I'd encourage you to check with the hospitals themselves. What we do know is they are very busy. And I think we always have to bear in mind, and I've said this before, but I think it bears repeating, the 100 or so COVID-19 patients are on top of what is the normal busy time of year for our hospitals. So it's not that people stopped having heart attacks and stopped having strokes and stopped getting cancer and stopped having car wrecks. All those things are still going on. And now on top of that, there's these additional nearly 100 patients. So it is a huge burden.
Thank you.
Aaron Bolton with Montana Public Radio again. Just curious, is there anything in the numbers that suggests we're nearing the peak of this current surge, at least in Yellowstone County, or are all indications that it's going to continue to grow?
So right now, Aaron, the numbers are just going up and up. What we do know in looking around the country is that in those parts of the country that are ahead of us and they surged earlier, the period of going up and then starting back down wasn't quite as long as the surge that we saw last fall and winter. So we're hopeful that we'll start to see the numbers come back down. As I noted, we are getting a few more people who are taking advantage of vaccinations, but right now we are still on the upswing. All right. Any last questions? All right. Thank you all for coming.